Tested and more than 20,000 of them tested negative. Governor Kevin Stitt says nearly 800 people have now recovered from the virus in Oklahoma. We have live team coverage this evening and begin with News on 6's Emery Bryan. He joins us live with more on the Governor's Solution Task Force.
Well, Governor Stitt was optimistic today that 11 days without an increase in hospitalizations was a sure trend for Oklahoma and a positive trend. He says he wants more Oklahomans to help tested to help track the virus because there are certainly people out there in Oklahoma with the infection who don't know they have it. Today, the governor reminded Oklahomans that even though it's Easter weekend, churches and families should not be gathering in large groups. The statewide limit for gatherings, no more than 10 people. Of course, in Tulsa, no social gatherings at all. He's urging people to stay apart a little longer because the expected peak for transmission is this coming week, the peak of hospitalization expected the week after. He's also urging with people with symptoms to see their doctor and urging physicians to order more tests.
We can test through one lab 2,800 a day, but we only got 1,000 test samples, and those are spread out between the multiple labs. But you should get tested if you have symptoms or if you've been in contact with someone that tested positive for COVID-19.
Now, the models for the state and for the country are a little more optimistic than they have been. Now show that Oklahoma would have enough capacity in hospitals to treat the expected number of COVID-19 patients with 3 times as many ventilators as they now expect would be needed. State Health importantly reports that 790 Oklahomans have had COVID-19 but are now recovering. Reporting live downtown.